The views and opinions expressed on any program are those of the producers and/or the persons appearing on the program and do not necessarily reflect the views and opinions of FRC Media, Bristol Community College, or the City of Fall River.
Thank you for joining us here on FRC Media. I'm Keith Tebow. It's Wednesday, and on Wednesday, we speak with the Mayor of the City of Fall River, Mayor Paul Coogan, who joins us from Government Center. Mayor, how are you this week?
I'm doing great, Keith. How about you?
I am doing well. Governor Healey was in Fall River yesterday at St. Anne's Hospital, sort of celebrating the sale of St. Anne's from Steward Healthcare to what is now Brown University Health. It was a celebratory event, and I know that you've been working closely with the members of Steward previously and now Brown Health for this to become reality, and it sort of came all together in one event yesterday. And I'm sure the governor was pleased with what she saw.
She was very pleased. When we walked around the hospital, she liked obviously, for some reason, they were focused on the cleanliness of the building. They kept talking about it everywhere we went. But when you got into the service being given to the patients by the nursing staff in the rooms, it was a very positive visit. And she was very, very impressed with what's going on. John Fernandez, the head of Lifespan, was also with us on the tour. And I know they have a number of ideas that they want to institute over there. And I believe it's going to be an upgrade from St. Anne's, which was already an excellent hospital. But it's anything positive in the right direction is what we want. It was really great because I did get to see a number of students that work there. And to have the whole legislative delegation with us, except for Alan Sylvia, was also positive. This is everybody's pulling the boat in the same direction, and hopefully we can turn this around so people can sleep better at night and know we have a nice, solid second hospital in the city of Fall River.
I know, well, one thing that we talked about before, I don't know if there's any update. Obviously, with Steward in charge, they were a for-profit hospital. The city was receiving tax money, over $1 million from Steward. Now that Brown University Health is in the picture, they're nonprofit, and usually nonprofits do not pay taxes. I know you talked about talking with Mr. Fernandez about some sort of pilot payment in lieu of tax program. Any update there?
No, we met twice, and we're gonna, like I said, he's still trying to find out where the parking lots are up there. We'll get together again shortly. We have some ideas of how we can offset that loss of revenue to the city, and it's going to be spread out, as I said to you before, among other businesses because we have a levy we have to make. But if there's a way for them to help the city of Fall River, they seem like they're on board with it. It's just going to take more conversations and come into a resolution that we think benefits both the hospital and the city of Fall River. As I've said 100 times, they're a key piece in the south end of the city for medical services, and we do not want to lose anything related to that hospital.
All right, moving on to other items. You announced this week that the retirement coming up of the EMS director, Chief Timothy Oliveira, is imminent, and you announced this week that Captain Nicholas Silva will serve as the interim director of EMS and interim chief in that role. What can you tell us about interim Chief Silva and what he brings to the department?
Nick is another one of those people that's worked their way up from paramedic to lieutenant to captain, all the way through the ranks. He's very aggressive. He's got a different perspective on how things should run up there, but at the same time, he has a very, very solid crew just underneath him, which have years and years of experience that will help guide him through this. I think EMS is a key piece in the city of Fall River going forward. Our partnership with South Coast Hospitals, which he was a key piece on making sure we get that strengthened, is going to grow and grow in the next few years. And we're looking to do the same with Brown Health, or formerly St. Anne's. That's another area where we're generating revenue, which can go back to the city. We have to work with Nick and his team on how to pull that money from EMS, which is a enterprise fund, and get it over to the city side. But paying for things that were allowed under law was the only way we're going to do it, and he's going to be a key piece of that. Obviously, we wish him nothing but the best. We had a few strong candidates looking for that position, but Nick came out on top after a series of interviews, and we wish him nothing but the best.
And what can you say about Chief Oliveira as he leaves his post and what he's been able to contribute to the city?
And Chief Oliveira did a great job for the city of Fall River. Another guy that worked his way up through the system. I really got to work, hand in hand with him when we tackled COVID, whether it was our test sites, whether it was the vaccinations, whether it was visiting people that were in the throes of COVID, bringing food. Tim did a great job through that whole stretch of time, and it was just the way I got to work with him more, because when we shut down, obviously EMS didn't shut down, and we were still in here on the 6th floor. So sometimes he'd be the only guy I could rely on to call to get things done right away. And when you look at what we did with our rolling test sites, I remember standing on Globe Street giving out test kits to people in the dead of winter, trying to get people to test for COVID. We've done a lot of great things with Tim. He's moving to Maine. He has a position up there that he's going to be doing the same kind of work, and we wish him nothing but the best, and we'll miss him.
You mentioned the relationship between EMS and South Coast Health. Tell us a little bit about how that works and how the city does realize some revenue from that.
Well, what happens is, obviously, when people are in the hospital, they're transported to other hospitals. They're transported to home via ambulance. And what happens in Fall River and in all cities is there's different ambulance companies that do the runs, whether it's Stat, Brewster. There's a number of ambulance companies that run patients in and out of both of our hospitals. If we can strengthen the relationship between Fall River EMS and they get the first call, no ambulance company can take all the calls. There's just too many. But if they can be the first one to get the call, then we can make sure we are able to keep a number of people working, get some more ambulances, hopefully, and get the revenue from those runs, whether it's paid by private insurance, Medicare, Medicaid, whatever. That money comes back to the EMS enterprise fund and supports that program. They're a standalone program right now, but if they can increase their revenues, it allows us to put it back into city facilities and city operations.
Yeah. I also want to shift to another public safety, some more public safety news. I believe State Senator Michael Rodrigues was announcing officially that the city again is receiving well over $1 million, I believe close to $1.5 million from the state in public safety staffing grants, which the city has received in the past to help staff our police and fire departments. And I know that's gone a long way in helping stabilize against those two departments and funding for staffing there.
Absolutely. It offsets a number of our overtime dollars that are being spent, whether people are out on sick leave or vacation or just not in work. It's a godsend to the city of Fall River, and obviously being spearheaded by Senator Rodrigues, but it needs the approval of the entire legislature. So and the governor has signed. So like all pieces of legislation, and I was with Senator Rodrigues last night a couple of times. It's something that's extremely helpful to the city of Fall River, and it fills a big gap that would be sitting in our budget if we didn't have that money.
Yeah. All right. Well, Mayor Paul Coogan, we're not going to meet next week prior to Thanksgiving, but I just want to wish you and your family and those at Government Center a happy Thanksgiving. And I'm sure you'll do the same here for everyone here in Fall River, right?
Oh, absolutely. We want everybody to have a nice Thanksgiving. We'll be over in New Bedford for the football game, and then we'll bounce around to some of the dinners that are going on in the city of Fall River. And I hope everybody has a happy, healthy holiday, and I'm sure we'll see you soon.
All right. Mayor, thank you for your time. We'll talk again in 2 weeks. I appreciate it.
Okay. Thanks, Keith.
All right. And thank you for joining us here at FRC Media. I'm Keith Tebow. Have a great rest of your day.